In chapter 22 in your concept book, we will talk about sexuality. And in this general term of human sexuality, we will discuss how people may express and experience themselves as sexual beings. And this is kind of a general concept that is including both the body as the physical carrier and also the soul, the way that we perceive the sexual behaviors. In a sense, is how do we perceive ourselves as feminine or masculine, regardless of how we were born in terms of gender characteristics. Those are the goals for this um, presentation today. And if we need to define sexuality, well, definitely the word has its roots in the word sex. Um, and as a pure definition, the meaning of sexuality will be an action or a fact of being sexual. Um, and that was defined many, many years ago in the 18th century. Um, about 100 years after that, in the 19th century, the sexuality um, the sexuality definition was changed a little bit, and in the new definition, we included the aspect of being capable of sexual feelings, not just the act itself. Um, Way later, 100 years later, in the 20th century, only in the 1980, uh, the definition was changed to include the idea of sexual identity and orientation. So, if we need to define it, the sexuality needs to be the state of physical, emotional, mental, or social well-being related to um, sexuality. And you will see how we'll discuss in this that there are several definitions that you will see that they are not overlapping. So sexuality is not merely um, being healthy and not having a dysfunction or a disease that compromise your sexuality from a physical point of view, but includes the mental, the social well-being, all those characteristics. So from this point of view, sexually healthy requires to have a positive and respectful approach to sexuality, and the sexual response um, includes the possibility of having pleasure and safe sexual experiences, and to be also free of any coercion, discrimination, and violence. Um, we'll go back to those terms, but I want now to define them a little bit. And the first one will be um, we will need to define sexual acts, sexuality, sexual identity, gender identity, sexual orientation, and sexual behaviors. So, in the scope and categories, um, definitely sex is one of the um, four primary drives, and the other drives that we have, there will be thirst, hunger, and avoidance of pain. So if you look into that, surviving elements will include the sex, because if we're going back to the previous presentation that we had from concepts, that's reproduction. Reproduction is essential for a species to continue to exist, to perpetuate itself. So it's one of the basic elements. Um, we will look now into what is called a sexual act. And a sexual act is any type of behavior that will include genitalia and those organs that are considered part of the genitalia and the erogenous area. Um, Now, when we're looking into sexuality, we need to define four subcategories of it. And when we are looking into sexual identity, is that thing that will make an individual male or female based merely on biological sexual characteristics, how you were born, a male or a female. Now, the gender identity is completely different, and it represents how an individual sees its own gender as masculine or feminine. And a lot of time, this will have social roots, and people will express their gender identity easier or less easier based on their experiences with the family, friends, and not in the last, not last on the list with the society. We have also sexual orientation, and that means how an individual sees itself in terms of being emotionally, romantically, sexually attracted to an individual or a particular gender. So the sexual orientation can be to the same uh, sex, to the opposite sex, or to both. And now we have sexual behavior, and that will include the way that someone will respond whenever is exposed to sexual impulses or desires. So, what will be some normal physiological responses? So, um, you kind of understand by now that sexuality and sexual response is a little bit more complicated than um, how you were probably thinking before, and a, it has three aspects, three perspectives. One will be the pure sexual response, and another one will be the age-related considerations, and the third one will be the sexual attitudes and behaviors. Now let's start with the first one, which is the sexual response. And in the 60s, mid 60s, there were a few researchers that were interested to see what would be the sexual response, and they looked and measured it from a physiological, a pure physiological um, um, point of view. They started to measure heart rate, blood pressure changes that can happen at the level of the genital size, the genital lubrication, and they were able to describe four consecutive phases that are consecutive in the human sexual response. And in those, we have the excitement, the plateau, so you know by now that you understand by now that sexuality is a complex aspect, and it's not um, as simple as you maybe thought that it was. And it can be seen from three different perspectives. One will be the sexual response. The second one will be the age-related considerations, and the last one will be the sexual attitudes and behavior. And let's start with the first one, with the sexual response. In the mid 60s, a group of researchers were um, studying the sexual response, and they looked at it from the pure physiological point of view. They started to measure heart rate, blood pressure, changes in genital size, genital lubrication that happened during stimulation and arousal and orgasm. And they found out, and they described actually four consecutive phases that they were part of the sexual response in humans. So they described excitement, plateau, the orgasmic, and the resolution phase. So let's describe this type of model and its general phases. The first one will be the motivation, and the motivation can be synonym for libido or sex drive. Is the desire to engage in sexual activity. So libido has a few components, has a biological component, has a psychological component, has a sociological component, and has a spiritual component. And while I'm saying all those, you understand why the libido can be impacted by medical conditions. And one example, a quick one that I can give you, is that a lot of women at menopause will have a reduced or a decreased libido due to a decrease in the hormones during or a perimenopausal period or after menopause. So medical condition can impact that. Medication can have implication because of that. Personality, lifestyle, relationship or environmental stressors can contribute to reduce the libido. The next stage will be the stage of the arousal. And in the stage of the arousal, you have the physiological response. Um, and as a result of that, there will be a release of neurotransmitters that will stimulate specific areas of the brain. And those areas are involved in emotions, motivation, and cognition. So human sexuality, we can say that has a sensual matter. You need to be turned off or turned on. Um, and that can come from a variety of stimulus, um, like sight or smell or sound or touch. And all those stimulus responses can be, the results of the stimuli can be either excitatory or inhibitory. Um, and they are the result of some neurotransmitters developing at the level of the brain. And we know by now that those excitatory neurotransmitters are dopamine, norepinephrine, and melanocortins, while those inhibitory neurotransmitters will be your serotonin, prolactin, and GABA. The next, um, the next phase will be the genital congestion. And this is a reflexive autonomic response and involves the activity of sympathetic and parasympathetic nervous systems. It can be defined as a vasocongestion, and it's not very long. It takes place in seconds following the sexual stimulus, and is the result of an increased blood flow at the level of genitalia. And we can describe it as clitoral swelling and vulvar engorgement in females with an increased vaginal lubrication, while in males, it's obviously the erection of the penis. However, it is known that there is a certain degree of flushing of skin everywhere on the body, and it's easier to be seen in those that have fair skin or in areas as face, torso, and even hands and feet. Once this stage is passed, we go into what is called the orgasm. And orgasm is in general a pleasurable sensation and is defined as a rapid contraction of the muscles in the genital and anal area. In some individuals, that can be contractions of the muscle throughout the body. And through this mechanism, the pelvic congestion starts to relieve slowly. Now, keep in mind that the orgasm is similar for both sexes. While in females, the contractions occur in the lower part of the vagina, can occur in the pelvic floor, the areas of the anus and the uterus. And about 10% of your women will be able to ejaculate the clear fluid through the urethra during the orgasm. And this fluid originates in what is called the Skinner's glands in the wall of the urethra. And it's very similar to the prostate fluid that you can find in the male ejaculate. In males, also the orgasm will be produced by pelvic floor muscle contractions, and as a result of that, you have the ejaculation of seminal fluid that usually is a pulsation, is pulsatile. Um, Now, it's obviously that is more evident that the ejaculation with orgasm is much more common in men than in female. However, you may find individuals that can have male individuals that can have an orgasm without an ejaculation. And the last stage of a sexual response will be a resolution. And that's a sense of well-being. The muscles will relax throughout the body. There is a certain degree of fatigue that follows an orgasm, especially when that was very intense. And the resolution is also related to the neurotransmitters, and especially to those um, prolactin and oxytocin that are released during an orgasm. And we know that oxytocin is one of those hormones that give us a sense of well-being. Um, in both males and females, the relaxation will occur slowly, and in male situation, there is a certain period of unresponsiveness that they cannot achieve another erection um, after an orgasm. So I told you that the second perspective is the age-related differences. And in humans, the sexuality can be seen as a developmental process um, that begins at conception and actually ends at death. Is kind of a process and develops throughout our continuous existence. And I say that because we are aware of our sexual self as our sexual identity very early in our existence, even in infancy. And that's a combination of biological and societal and cultural and familial factors. So we observe the development of sexuality throughout childhood, pre-adolescence, adolescence, and adulthood. And there are three attributes that need to develop properly in order for an individual to reach its own sexuality. And that will be the gender identity, the sexual response, and the capacity to have meaningful, intimate relationships. And we'll discuss a few of those stages of sexual development. So we have the stage of the childhood that starts at birth and continues up to 7 years when I was telling you that we see that even in infancy because baby boys will get erections and baby girls may exhibit increased vaginal lubrication, um, and infants of both sexes can be observed fondling their own genitals as a natural form of pleasuring and expression of sexual desires and arousal. What I'm trying to say is that at this age, they do not have any meaning for that. It's just a pleasurable feeling. And something else that is observed in childhood, even early childhood, is the fact that there is a type of sexual interest and activity in the way that some children may play by copying an adult model as play house, play doctor, and in all those activities, there is a high need of a positive interaction with those children and guidance in order for them to develop, to shape their sexual and emotional relationship later in life and not compromise the development of their sexual response. The pre-adolescence starts around age 8 and continues until age 12. At this age, we observe a little bit of more social division between boys and girls. They start to have their own groups. There is still sexual curiosity, and there is some learning that occurs between children of the same sex. Um, and a lot of children will be engaged in masturbation during this stage, kind of the same percentage that was reported up to 40% in both genders. The adolescent stage starts at 13, continues until age 19 when the adulthood starts, and the physical changes associated with puberty are literally evident at this stage. And the fact that physically they become more mature may signal the possibility of an adult-like sexual activity. So the sexual expression at this stage is influenced by psychosocial factors that may facilitate or inhibit this behavior. So at this stage, we have two developmental tasks. Learning, the learning to manage physical and emotional aspects of sexuality, and resolving the conflict between identity and role confusion. The next stage, that is the adulthood, that starts around age 20 and continues the entire life. is the maturation of the um, sexual development of the sexuality of an individual. And during this stage, the adults are actually learning to effectively communicate in intimate relationship and also learn to make informed decisions about sexual health. At this stage, adults start to make sexual lifestyle options. They may decide to opt for celibacy, for long-term monogamy, for serial monogamy, for polyamory. There are a lot of a wide range of sexual functioning, sexual interest and desire during this stage. Now, the last um, point of view, the last perspective will be the positive sexual attitudes and behavior. So in the positive sexual attitudes and behavior, the most important component is the one of being present. That means to be in the moment and fully attentive, to show that immersion and intensely focused attention during the sexual activity. Um, Being present is a very much connected with another aspect, which is called authenticity, is the feeling free to express themselves in the presence of a partner. Another component will be the intense emotional connection, and that's the intimacy that the individual needs to experience during the sexual encounter. For many couples, this emotional connection needs to be present both inside and outside the bedroom in order to have a strong relationship, um, to have a partnership. Um, the next component will be the sexual and erotic intimacy, and that's the a sense of caring for one another, regardless of the length of the relationship. Um, And next component will be the communication. And communication is crucial for anything, not only for having a healthy relationship and especially to have a healthy sexual encounter. And in this is not just the verbal communication, but also showing empathy and making sure that the partner's needs are known and respected and addressed. And the last component is the transcendence, and that's that feeling of a higher mental, emotional, physical, relational, and spiritual state of mind is a result of uh, having a sexual relationship. As with any concepts, we will discuss also variation and context. And many individuals may experience a wide variety of sexual issues. Um, when we are looking into the etiology of sexual disorders, we can um, classify them by the factors that will determine them. And if we are looking into the physiological factors, um, if an individual has an acute illness, is after surgery, is going through trauma, has specific medication, loss of mobility, may have drugs, alcohol, or substance abuse, all those physiological conditions may affect their ability to uh, express their sexuality in a healthy way. Also, other physiological factors can be normal and natural as pregnancy or the process of aging. They are not pathological, but um, they may cause sexual dysfunction. Psychological factors, um, especially those that include emotional elements as fear or anxiety, fatigue, um, in couples that they have reproductive concerns, those that are in not able to conceive, they may show an increased anxiety and stress, and as a result of that, their sexuality can be compromised. Maturational factors, and those um, are related to the knowledge deficit regarding the individual's own sexuality, regarding safe sex practices, and sometimes related to the changes associated with aging. And the last type of factors will be environmental, and include um, those pollutants or chemicals that can decrease the sexual function, and also maybe situational factors as social isolation, lack of a partner, that can create a sexual disorder. Also, in the variation, we need to look into the sexual transmitted diseases. Um, and that's a wide variety of STDs, formerly known as STDs. They are now called sexual transmitted infections. They are not just diseases, we know that they're infections. We can have parasites and viruses and bacteria, and a lot of them will increase the risk for cancer. Some of them are, um, they can be very dangerous in the eventual situation of a pregnancy, as chlamydia. Um, Most of them are highly curable with treatment if that is done correctly. And now, if we are looking to specific categories of female and male sexual disorders, just by looking at the female, it's been said that about 40% of the women in the United States will have a certain degree of sexual dysfunction. And this is seen in women at any age. It's not specific for one category. And again, we are going back to the same physiological factors sometimes, and we may find out that um, the sexual dysfunction is related to diabetes, or to neuropathy, or to a hormone imbalance. If we are looking into psychological factors, it can be related to stress, anxiety, or depression. For male sexual disorders, um, a lot of them experience dysfunction related to sexual desire, libido, lack of arousal, or um, there will be a lot of men with sexual disorders that may experience erectile dysfunction or ejaculatory disorders. Um, there are consequences as a result of sexual dysfunction, that they are both physiological and psychological. And you have a list here of physiological consequences. And you see that they include unfulfilled sexual desire, unsatisfactory sexual response, pain, STIs, infertility, uh, pregnancy with complication, and you may have also psychosocial consequences, as problems with relationship, starting on maintaining them, low self-esteem, anxiety, and depression. When we are looking at the risk factors, and we split them into population of risk, um, just like I was telling you during the reproduction lecture, the adolescents are at higher risk. And that's because of lack of understanding, lack of maturity. They may expose themselves to an increased risk to acquire STIs, to acquire HIV. The risk of unintended pregnancy is very high, and not the least, sexual violence, regardless if they are male or female adolescents, are at a higher risk for that. Um, Populations that have disability, and that those disabilities can be any type: cognitive, developmental, and physical. Um, Now we need to understand that people that have disabilities have the same type of sexual desires like normal people, and they are entitled to accomplish their sexual desires and social maturation as anyone else, like a person without a disability. And they are entitled to do that without um, being enforced or go through any kind of hardship. Another population at risk may be, there are the people that are newly unpartnered. And when I say unpartnered, it's a general term for those that are either go, going through a divorce, or their partner is deceased. They have an increased risk also for unhealthy sexual behaviors. They may slide into having multiple partners, and they may be exposed to an increased risk for STDs. The last population that is at risk is those that have a different sexual orientation than um, regular, including lesbian, gay, bisexual, and transgender, that also have an increased risk for acquiring sexually transmitted disease, and they may be exposed to violence. Um, I think that we are not acknowledging enough that transgender population has a very high risk to being abused. Inside the individual risk factors, we can define those behaviors that have a high risk, and in this category, we'll put those patients or those clients that have multiple and casual partners. um, that's those people that will fail to practice safe sex and maintain those measures, and whenever their sexual activity will be associated with use of alcohol, illicit drugs, or any other illicit substances, um, that will expose them to a higher risk category. In addition, the risk factors for individuals may be those that have underlying medical conditions, those that have heart and lung disease, people that have mental conditions, and those that they have any kind of chronic condition may expose them to um, increased risk factor, may expose them as an increased risk factor. And when we are looking at the medical conditions, we need to include those that are on all kind of medications as antihypertensive, anti-ulcer that will create a decreased, will may expose the patients to erectile dysfunction, antipsychotic, diuretics, narcotics, anticonvulsants. So when we are assessing those type of patients, history is essential. It's one of the most important things, and we always need to start with the 5 Ps. We are looking into the number of partners. We need to know the number and the gender of the client's sexual partners, the practices, if they practice the safe sex, if they had reports with more than one partner in the past 12 months, and if the patient has had sex with a partner who has other sex partners, that will increase their risk, will put them in a different category. And also we need to include the question about protection. What will be the protection against STIs? How do we know that they are practicing safe sex? We will ask about the past history of infection, and we'll ask, especially in females, about any kind of measures or practices to prevent the pregnancy. For when we are talking about sexuality, we need to add to the history, all those elements that are related to usual sexual partners. Um, Again, number of partners, level of satisfaction with the sexual activity, the frequency of sexual activity, and the knowledge regarding the sexual activity. And also, it's important to ask our patients what are their perceived problems? How do they perceive the issue? When we are examining the patients, the female GYN examination will include a full external and internal structure, external and internal genitalia evaluation by inspection, palpation. Um, Not you as a nurse, but the provider will do the bimanual palpation, uterus and ovaries, and if needed, if the history guides you toward that, a collection of specimen will be performed. For male examination, just the same, the examination of genitalia will include a full exam of the testicle and the prostate. Um, will have the prostate will be examined by DRE or digital rectal examination, and if the history points to that, a collection of specimen will be performed. Again, keep in mind the male examination will be performed by the physician or the common diagnostic tests that we perform will be the pap smear, the PSA, testing for any kind of sexual transmitted infection if that's a suspicion for that. We can do genetic screening and hormonal assays if needed. Clinical management in the primary prevention, again, we are talking about patient education and counseling and referral if needed. So we need to talk about um, how they can prevent sexually transmitted infections, how they can prevent pregnancy and unwanted pregnancy, um, condom use, safe sex practices are the most important elements and should start at a very early age. Nowadays, in primary prevention, we have Gardasil, which is the HPV vaccination that is um, mainly recommended for girls between 9 and 11 years of age when they have not started their sexual life yet. However, it's highly recommended to be performed on male also, um, though, again, the chance that they will develop penile cancer from HPV is very, very small. They do transmit the HPV virus if they become infected. And by vaccinating the males, also, you cut into the chain of transmission. Secondary prevention will include screening strategies to diagnose an existing illness and to prevent future complications. So we are screening for STIs, those patients that are at increased risk. We do screen for intimate partner violence. This is a very important element that we need to become aware of and to recognize abuse that can be physical or mental. We perform pap smears and we do HIV screening in high risk categories. In terms of collaborative intervention, depending on the issue that we are going to address, we can use pharmacological agents, and that will be for the treatment of mainly for STIs. We can use them for erectile dysfunction or to compensate and improve the symptoms of menopause. We can use pessaries. Those are devices that will support the pelvic floor. We can perform surgery to correct any conditions that may lead to sexual dysfunction, and we can offer our patients sexual counseling. And those are the interrelated concepts that we discussed today. It's obviously that reproduction is intimate, and that's why the picture is so close between the reproduction and sexuality. So reproduction is intimate related to that, and everything that affects reproduction may affect sexuality, and the opposite. You can see that anxiety can keep the body and mind and spirit preoccupied and can compromise sexuality along with stress. Also, whenever there is pain um, as a physical dysfunction, the sexuality will be compromised. And definitely, if the gas exchange and the circulation is compromised, the sexuality will come on the second, if not the third place for that individual.